So that concludes all of the lectures in the Basics of Respiratory Support for Nurses package. By engaging in these lectures, you will have learned about the importance of respiratory assessment, respiratory therapies, and the associated person-centred nursing care, and the importance of monitoring these therapies and the patient's clinical response to reduce complications and improve outcomes. The take-home messages from our clinical experts and their talks are: in Lecture 1, Johannes talked about basic anatomy and physiology of the respiratory system. Positive pressure ventilation alters the normal physiology of respiration. It is important to know about and understand this, about positive pressure ventilation and the effects of ventilation on the body systems and how that's managed. In Lecture 2, we heard from Carol, who talked about intubation and endotracheal tube management. Carol emphasised the importance of using the checklists, focusing on the patient, and communication within the team. In Lecture 3, Steve discussed suctioning and mouth care. Steve highlighted the importance of good oral care and how that can reduce ventilator-associated pneumonia, that safe suctioning is an essential part of a ventilated patient's care. Oral care and suctioning as part of daily safety checks, and to seek help if there's any concerns. In Lecture 4, Ventilation Basics and Modes, Elsa talked of the need for mechanical ventilation in ICU patients. Nurses working with ventilated patients need essential knowledge of the equipment and basic modes of ventilation used in their units. Ventilators may fail, they are devices, and that may happen. So safety checks to ensure patient safety in an emergency are really important and something that you will learn from day one in the ICU. A ventilated patient requires continuous monitoring of all systems. Positive pressure ventilation affects all systems. Ventilated patients fully depend on their nurses, on you, their nurses, for the fundamental aspects of care: hygiene, positioning, nutrition, mouth care, and communication. In Lecture 5, we heard from Jonathan on ventilation monitoring and end-tidal CO2 monitoring. Jonathan stressed the importance of assessing and observing patients in relation to their ventilation, the importance of pain, agitation, and sedation assessments and scoring tools, and how important these are, and observations of the patients and getting to know the patient in assessing patients' readiness to wean. Jonathan also talked about weaning protocols, about how there are many, and each unit will have their own specific ones that you'll be enabled to follow, and the role of sedation holds in that weaning of patients from ventilation. Jonathan also really stressed the importance of communicating with and reassuring the patient during their ventilation and during their weaning time. In Lecture 5, we heard from David about proning and repositioning. Prone position is widely used in severe cases of COVID-19. It can result in significant improvement in gas exchange and oxygenation. Proning requires a skilled team and excellent communication within that team. Complications are common and can be prevented with care and attention to detail. Checklists are also useful tools to support this process. And you see a number of different themes running throughout here: the importance of good communication, the importance of teamwork, and the importance of checklists. And finally, in Lecture 7, Troubleshooting, Laura talked about how clinical assessment and observation of the patient are important for early recognition and correction of early signs of deterioration. Importantly, alarms should be attended to immediately and not ignored. And if you're not sure what's going on, call for help. Never silence an alarm if you don't know what the problem is and how it can be fixed. Safety checks and relevant alarm settings are important for alerting the nurse that something is wrong. A care bundle is a set of evidence-based actions that can prevent ventilator-associated pneumonia and other complications. And Laura very, very reassuringly said at the end, be assured that you are working in a supportive ICU team and always call for help when you're concerned about patient's condition or when an alarm is sounding and you cannot find or resolve the problem. We would like to thank all of our expert critical care lecturers, Johannes Mellinghoff, Carol Boulanger, Steve Simpson, Elsa Alfonso, Jonathan Downham, David McWilliams, and Laura Galzara Baccarina for their engaging and informative talks and for sharing their clinical knowledge and expertise with us. And thank you for engaging in these lectures, and thank you for coming to Critical Care to care and support with the the ill patients during this time. We hope that you find that these lectures are beneficial to give you confidence and knowledge that you can apply in your nursing practice in the ICU.